So, hello everyone. Welcome to this Facebook Live. This is a very important topic, especially where we are in the midst of a pandemic, where we've seen two waves affect India, Tamil Nadu, Chennai, and here we are three of us. I'd like to introduce firstly Dr. Sabanayagam. He's our clinical lead intensivist at MGM Healthcare, and he has played a very integral part in the last couple of waves of COVID-19, where he's treated a lot of patients, sick patients who are in the ICU with COVID. So it'll be great to interact with him and understand about what patients became sick, what sort of patients became sick, and why they became sick, and is there a possibility or way to prevent them from getting into this, even if you contract COVID-19, what are the things that we can do probably to reduce the intensity. We also have Mrs. Priyanka, who's our clinical nutritionist and our bariatric coordinator. She's also a lifestyle counselor. She will probably give us more ideas on how effective lifestyle modifications will help in weight loss as well as other things as well. Myself, I'm Dr. Deepak Subramanian. I am the clinical lead of minimal access and bariatric surgery at MGM Healthcare. So, without further delay, Dr. Sabanayagam, I'd like to ask Dr. Sabha about. I'm sure you would have seen in the last couple of years a lot of patients who became sick with COVID. If you can give us a broad spectrum of about the profiling of these patients, that would be great for understanding for the viewers as well.
Sure, Deepak. Thanks for having me here to start with. And come December, it will almost be 2 years that we are facing this unprecedented pandemic of COVID-19, and it's taken so much of toll, both patient side as well as the healthcare, every sector that you could imagine. Coming to your specific question, the patient profiling. So I can probably divide this COVID from our Indian experience into two waves, the first wave and the second wave. In the first wave, most of our patients were in the elderly age group. We saw very few patients who were younger than 40 years and almost zero pediatric patients or kids. But the second wave, which was a lot worse than the first wave, the most recent one, which started somewhere in April and now slowly mellowing down, that was very different to the first wave in multiple ways. One important thing is we started seeing patients much younger, even kids, especially people in their age group between 20 and 40, whom we did not encounter in the first wave. That's one important difference. And the second thing is both the first and second wave. Yes, we did have lots of patients with medical problems like diabetes, hypertension, people with lung diseases, heart diseases, people with who are overweight or in other words obese. We did have a lot of patients, but they were lesser in the second wave. They were more in the first wave. But these medical problems that I'm talking about played a significant role in patients having a severe form of COVID illness. In other words, patients who did not have these infections or these medical problems tend to have severe disease, but they recovered very well. But those ones with these medical problems, even the moderate ones and the severe ones as well, they tend to have quite a severe disease that they ended up getting admitted in the intensive care, and they ended up getting ventilated, like requiring life support, and there were lots of deaths in this group as well. And so specifically to mention again, to re-emphasize, it's high blood pressure, diabetes, and patients who are overweight, and then obviously people who were in the elderly age group. The last big difference that I would like to mention in the second wave is that those patients who are overweight and diabetics, even though they were in the younger age group, those were in the 20s to 40s, they tend to get a severe disease in the second wave.
Yeah, I wanted to just actually, when you were speaking, my next question was that because you did mention this in the second wave, you had a lot of patients in the 20 to 40 age group. And I wanted to ask you specifically, but I think in the end you answered the question, the people who were on the overweight side having this. Now, I just want to move to Priyanka here. And I know you are a lifestyle counselor and a practicing clinical nutritionist. How often do you see a younger I'm saying a younger meaning, let's say the age group what Dr. Sabha that just mentioned, 20 to 40 age group who are coming under the overweight or the obese criteria. At the same time, I think it would be great, Priyanka, for viewers if you could explain what exactly means, what is obesity? Many people just think that by looks, if somebody is on the little on the higher side of obesity, but by medical terms, it would be great if you could just, put across what exactly obesity and overweight means.
So right, so coming to the first part of your question, where you asked me how often I encounter obese or overweight individuals in the 20 to 40 category. It's very often right now. So it's quite often that I encounter obese or overweight patients these days. One major reason would be that the lifestyle has changed, significantly changed in the last 10 years. So we are now more accessible to fast food, junk food. Everything is a phone calls away. So everything is very accessible right now. So I would say that this is one of the major factors. Our lifestyle is one of the major factors, and nutrition has taken a big slump because we are not bothered anymore about eating quality food. It's more about the quantity these days. So quality food itself has gone. So coming to the second part of the question where you asked about obesity. So obesity is not just when a person has excess body fat. It's also about BMI, body mass index. So when a person's body mass index is over 30, we call them obese. So 25 to 30 category is overweight. Anything over 30 is obesity. And a healthy BMI category would be 18 to 25. So if we maintain between that category, it would be very ideal for us.
So, Dr. Sabanayagam, since Mrs. Priyanka just mentioned about this, uh, if you had to kind of, if I asked you retrospectively on numbers, the people who became sick, which criteria or what BMI were they in who became extremely sick? They may have recovered, but became extremely sick, or may have did not recover. But on a gross note, I know it's difficult to give exact numbers, but if you could
Now,
just
see, it's a good question. But most of them would have been in the obese category. As Priyanka said, they would have been like more than a BMI of 30 more. So, and especially as the weight increases, or in other words, as the BMI increases, it goes to 35 and 40, where you call them morbidly obese or super morbidly obese and all that. The risk increases significantly.
what happens? What happens in these patients? Tell us why they become sick.
Yeah, another good question actually. So there has been various papers put out on why these patients are vulnerable for severe infections and the reasons why they don't recover well from COVID. I guess you can probably classify into two things. One is that these patients who are obese, they also have other medical problems like high blood pressure, like diabetes, they may also have lung conditions, breathing problems. It all comes as a package, right? So that is one important reason. They have the other medical problems along with their obesity. And the second reason is that when people get sick for whatever reason, not just COVID alone, when they're obese, they don't do well. And it is because the body doesn't take the insult as much as a person who has got a normal weight. That is one problem. Just to put it in simple terms, a person who's critically ill, let's say, has got a severe COVID infection, lying in the bed, a person just lying in the bed can actually have many problems, including lung breathing problems, accumulation of water in the wrong space, and all the organs tend to slow down and all that. So as it is, these obese patients have all these problems even before they have this infection, and this infection makes it worse. So it's a combination of these two.
Yeah, I think that's something which is very much underplayed. Many people think, as I initially itself pointed out, obesity as such. People think that okay, only when somebody is really huge, when they on looks, that's obese. But I think if one starts to calculate the BMI of say 100 people in a random manner, I think quite a few would be under the obese category, and that becomes very important for many other things, which we will talk to on solutions in a while. So, simple steps, if I may ask Priyanka. Okay, we are in the midst of say, I'm not sure whether we are going to have a third wave. I'll move again to Dr. Sabanayagam here. we are between probably the second wave. We are not sure if there is going to be a third wave. There are lots of reports about it. What are possibly the things that a simple somebody at home can take care of if they are under the obese category, as we discussed about on BMI, based on BMI?
I mean, to be honest, COVID has actually changed our entire way of living, I would say. It's not just that obesity gives rise to severe COVID. Again, it's like COVID also is equally contributing to obesity. You have kids sitting at home, not playing and all that. You have the working population, your productive age working from home, and you have the elderly, you're just literally keeping them at home so that they don't get an infection. It's like a complete mess. We're just doing everything that's not supposed to be done. But within all these restrictions, I'm sure there are plenty of ways where we can actually try and do what we can do to, try and keep away from people who have infections or places where you can potentially get infections and all that. There are plenty of things that you could do. I mean, all of this is what you know. It's been almost 2 years. It's like, social distancing, wearing the mask and all that. Within the house, if there is a member of the family who's got a possible COVID infection, irrespective of whether they test positive or not, the most important thing is to isolate, especially keep the high risk ones away, those things. And I'm sure that probably the public is a lot more expert than the doctors themselves.
Yeah, and one thing is, I think how as because there's still a lot of doubts on vaccination among the general public. I see that there is a little bit of increase in the number of people who are getting vaccinated as we speak. But any influence on vaccination and on obese people? Is there
Definitely, definitely. I think vaccination is very protective against severe illness. There are countries like Western world, like let me take the United Kingdom as an example, where the number of people who are seropositive, or in other words, have got antibodies to COVID infection either by virtue of getting the infection or by virtue of having the vaccine. It's almost approaching 90%. That's a fantastic number. And they do have lots of people who get reinfection these days, but the best part is a lot of patients are not getting hospitalized, or in other words, they're not getting a severe infection. The number of people who are positive might be quite high, but the number of people who are hospitalized is very, very, very low. So that directly indicates that vaccine is protective for all patients and obese patients as well.
So, Dr. Deepak, do you think bariatric surgery or weight management, obesity management, is helpful in preventing COVID-19?
I don't think it's help. I think Dr. Sabha mentioned about it. I don't think, see, if somebody has lost weight, I don't think that helps them in preventing in getting the infection. But I think it helps a lot in preventing the severity of the disease. As Dr. Sabha had mentioned, most of the patients who became sick were patients who either had any comorbidities like diabetes and other things, and one of the other comorbidities was also obesity. So before even coming into bariatric surgery, I think there are a lot of other methods which people can adopt for weight loss, and one of the most easiest and the simplest forms would probably be a healthy and good diet. And I think Priyanka must possibly give the viewers a good idea about what would be the best possible diet to probably shed a few kilos.
Definitely. So, coming to the obesity management itself, so when Dr. Sabanayagam was telling about how obese people had other comorbidities while fighting COVID infection, I must also mention that they also had nutritional deficiencies. So these nutritional deficiencies like zinc deficiency, vitamin D deficiency, all these are very common in obese people, and that also significantly contributes to slower recovery rates, and also contributing to other comorbidities like hypertension and so on. So it's very important to address nutritional deficiencies. At the same time, it's also important that you manage your lifestyle, even though we are indoors, even though we are not being able to go to the gym or be very active. Try to be as active as possible. It could be simply climbing up and down the stairs in your house. So that could be one of the workout or activity that you can do at home. Even childhood obesity can be easily prevented by keeping them very active. Also by following a very healthy diet. So coming to the healthy diet, I know it's a vast topic, but try to eat fresh and local as much as possible. Eat whole foods like fruits, vegetables, whole grains, include them as much as possible. Try to eat only fresh foods, cook them fresh, eat them fresh, don't store them in the fridge or freezer and eat them after a few days. Try to consume them fresh. Don't buy outside and eat, avoid eating outside. One is to prevent infection, spread of infection. The other is to avoid any unhealthy eating practices. So that would be very beneficial for the society.
I just have
Yes.
just, I mean, I have seen some patients. There are also people in the family where they've tried these bits you're talking about, like, they've done their bits with food and eating healthy food, restricting diet and all that, and then they've tried their bit in exercise and activity, keeping themselves very fit, trying to keep them on. But still, they haven't managed to shed as much weight as they want to.
Right.
Is there anything more, anything else that could be done, either with the diet or something else medically, surgically?
Right. So coming to why they've not been able to do it in spite of trying all these weight management tips, it's because it is a lifestyle change. So it's not an overnight thing which happens in 1 month or 2 month programs or a crash course, anything. It doesn't happen with fad diets like keto, paleo. All these don't do the trick. It's a lifestyle change that you have to bring about in your life. Like whatever I said, like including whole foods, making climbing up the stairs a mandatory thing to do every single day. So all these must be a part of your lifestyle and not just for the 1 or 2 months that you're taking up the program with the nutritionist.
And I personally think overweight or obesity is must be addressed in a 360-degree. It should not be unilateral. I don't think any weight management, whatever type you're talking about, it could be diet or exercise or surgery or medical management. I don't think one single method works. I think it should be a combination of many things, and the most important of it is the patient's drive and the motivation towards it. Because it cannot be thrusted upon anybody. It should be the patient themselves realizing that yes, they want to shed this much weight and they must come to have a healthy lifestyle, and that's when it really works. And that's how I have seen success as well in many patients where we have done bariatric surgeries, where how much ever the parents bring the children saying they need to lose weight, can we undergo the surgery? But if unless and until the patient, whoever he or she or whoever it may be, is motivated, self-motivated, because even in bariatric surgery, which is weight loss surgery, it is not just about doing the surgery and then they lose. There is a lot more that the patient needs to do along with the surgery, and they need to travel. We the team, the clinical team, we travel along with the patient along this journey. But it's very important that the patient must be motivated. That becomes a very crucial factor. So as Priyanka said, diet becomes a very important part. So as she asked me a question on bariatric surgery, yes, it helps. It really helps. We have a very clear indication and guidelines for which that when we do bariatric surgery, when somebody is over a BMI of 34 or 35, that's when we offer bariatric surgery. Anything less than that, if they have comorbidities, yes, we do offer them. But anybody lesser than 30, I think the best solutions is to go for a combination of diet and exercise. Today, you don't need to go to the gym to actually work out. I think there is enough online material that is available where you can even do enough number of steps per day. I mean, most of the country has smartphones which can track the number of steps that you do per day. And on average, if you actually, you'll be surprised that many times when you look at your pedometer in your phone, by 3 p.m., I've seen many patients when they come to me for consults, I'll ask them to just show me how many steps they've done from morning till 3 p.m. It would actually show only about 400 to 500 steps, which is pathetic. On average, we need to probably touch about 8,000 steps, 7,000 to 8,000 steps per day, which I think with cars and most of the times we lift using lifts and other things, we don't do that much. So an effective way it would be touch at least 10,000 to 12,000 steps if you are in the process of losing weight. And a combination of that, along with that, a good diet will really help if you are on overweight criteria. Yes, bariatric surgery is a solution. It's always available. But even as surgeons, we generally don't directly ask the patient to go for surgery because we want to assess the patient's motivation. If they're losing even 3 to 4 kilos, even in the period when they are on diet and exercise, that really helps us in identifying the right candidate. That becomes a successful surgery. So coming back to one point which we spoke about COVID, and that's why we are here, as if, for example, somebody lost weight, a sudden loss of weight, I mean, there could be many reasons. They're on an extremely good diet along with exercise, or they may have undergone bariatric surgery. Does that have any influence in the part where they, or immunity part, where they have a higher chance of contracting a COVID infection?
Um, it's an interesting question. We are still trying to find the answers on how this weight reduction program, irrespective of how they lost weight, works on COVID infection. But what we have seen in the last 2 years of experience over here, we've had almost like 1,000 intensive care patients alone in this hospital. We've had almost like 5,000 ward patients in our hospital in the last 2 years of our COVID work, almost 2 years of COVID work. Uh, we haven't seen anybody who's had a bariatric surgery and lost weight who has come with a severe infection to the hospital. That's actually a very good thing. In other words, if you have lost weight and if you have come in the safe zone of BMI, let's say less than 25 is a safe zone, let's assume, then you're probably safe as well. That's one good thing, irrespective of how you have lost your weight, whether it's from activities or diet or bariatric surgery. So, that's probably what the international experience is there as well. Yeah.
Right. That's actually interesting because a few of my patients who had undergone surgery did contract the infection, but again, as you said, they never had to probably meet you because you are more in the ICU.
Yeah.
So that's actually a good move. From Priyanka's perspective, other than diet, anything else from the lifestyle side which you think has played a very important role in weight loss, or which you think which has also played a very important role in people not getting a severe COVID infection?
So coming to lifestyle, like you said, there are plenty of home workout videos that are available. So lifestyle includes a wide variety of things. So it includes from choosing the right foods to eat, being very active on the whole. Even like as simple as cooking plays a big role in lifestyle. So one by methods of stress busting. Stress also comes under lifestyle change. So once you start losing the stress or manage your stress very well, it contributes towards a healthy lifestyle change. So there are plenty of lifestyle changes that need to be incorporated even for losing 5 to 10% of your body weight. So it's very important. So on that side, I want to ask you, what are the indications for a person to have bariatric surgery?
No, as I said, indications we go about with only
The BMI.
the BMI. That's one thing which I already mentioned. But I think personally, I think what I have I've created a system for myself, at least in this hospital, is one thing is what I look for in a patient. Even though if the patient comes with a BMI of 40, if that patient is not motivated enough, then I don't offer surgery for those patients. Honestly, they should be motivated and they should be ready to accept the lifestyle changes that they will have to do post the surgery, because the results of the surgery is very, very important. It's based upon these things more than the surgery. The surgery is a procedure, it's standardized, it's done around the world, and most of us do it in the same fashion. But it's the patient's specific profiling. That's what and if you ask me, if you bring me two patients in front of me, both are a 40 BMI, and if you say both of them will they lose the same amount of weight and will they come to a normal BMI, the answer will be no, because each patient's profile is different, and it's very, very customized, and this is why we have a dedicated department here to actually take care of their needs. But coming back to one point which you mentioned about stress, and I think that's something very, very important these days. There are enough and more patients with obesity, and I know stress, depression has played a very important role in COVID-19 as well over the last couple of years. People have lost jobs, people have been emotionally down and other things. And in the process, I have seen a few patients gaining weight as well, because I think both stress, depression, and obesity go hand in hand. And where do we draw a line to this in terms of we don't have a psychiatrist in this panel, unfortunately, or a clinical psychologist in this panel. But I'm sure ICU, you would have seen a lot of profile of patients who are probably stressed, who have stress as a very important factor, or depression as a very important factor, and who are also obese. How frequently do you see
We
this?
do see, because we manage the coronary care unit part as well, and there I tend to see a lot of patients who probably match what you're talking about. It's a combination of stress and then the metabolic diseases that we commonly call as high blood pressure, diabetes, obesity, and all that. Work style is something which is very, very important, which determines the stress again. The patient profile, the patients that we see generally uh, tend to be like highly functioning people, people who do stressful jobs, people who hold very high positions, people who do lots of nighttime work and all that, like who work across different time zones, who work for the countries which are like 12 hours behind or a few hours ahead of us. Now, these are the people who don't get proper sleep, who, by virtue of their profession, tend to be stressed out a lot. They have lots of heart issues as well. So I think it all comes as a package, and it's a very, very important thing to try and find out ways and means to minimize the stress. Now, as you're talking about it, again we tend to see lots of patients with comorbids, not only the COVID side, the non-COVID side also, people who tend to have these sort of common problems like high blood pressure, diabetes, and all that. Does obesity contribute to these ones, or in other words, does losing weight add any more benefit to these people?
Yeah, that's a very, very direct benefit. In fact, I would say there's an entity called metabolic syndrome, wherein a patient having who's also on the obese side, having any of these comorbidities which you mentioned in terms of high blood pressure, diabetes, high blood cholesterol levels, all these things actually play a very important role. And India being almost a capital of diabetes around the world, I would say it's very, very common that you see a patient with metabolic syndrome, and dig down and go down to the root cause analysis of these patients, you will see that overweight or obesity has been a very important factor. Yes, bariatric surgery really helps. In fact, the term bariatric surgery has now been off late being changed across as metabolic surgery. One of the reasons is this, that it has really helped in resolution of diabetes. People who are on very high insulin levels or on high medications for diabetes, and the results are better if the duration of diabetes is small, it's shorter. So there is a study done across the world called the ABC trial, where the duration of diabetes, if it is less than 5 years, and they're also on the obese side, if they undergo a metabolic surgery, the chances of resolution of diabetes, in fact, is as big as 99%. They may not require medications for diabetes after the surgery over a 1 year period of time. So there's a lot of big impacts that has come in terms of these things, and studies that have come, and we've seen it clearly in many results. One of the most important contributing factors we've seen is infertility in obesity, and today many with stress being one of the factors, obesity and many things, I think PCO and other things. I think obesity has played a very big role in infertility, and with bariatric surgery we've had patients where we could reverse infertility and kind of they could have a child later on, which gives them utmost happiness. So if there's any other questions from we could probably take.
So we have a few questions.
Yeah.
The first one would be how to educate pregnant women to lose weight in order to refrain from getting affected by COVID. Can somebody take it?
So who would be the better person?
Yeah, I mean, pregnancy and weight gain goes hand in hand. Fortunately or unfortunately, women tend to put on weight more than what they gain for the sake of baby alone, and it's very difficult for them to shed the weight in the subsequent months or years as well, because gaining is easy, shedding is always difficult, as we know. So I guess you always need to have a real watch on what you're gaining, and what is healthy weight gain, what is unhealthy weight gain, and all that, even when you're pregnant. That's one important thing. And as Mrs. Priyanka has been saying, it's always about keeping a close watch on what you eat, healthy food. I think that's probably one very, very, very important thing that we have to do even at times of pregnancy, especially the Indian way of treating a pregnant mother, pregnant woman is very different to the Western world. Here, you're just pampered like anything by your family members, and you tend to put on weight so easily. So keeping a close watch on your food, what you eat. That's one thing. And second thing is being physically active, both whilst being pregnant as well as after the delivery. And again, that comes part of our family pampering, where women are not generally allowed to do much of work when they are pregnant, and then after work also, because for the sake that they are caring for the baby and that they're breastfeeding and all that, they don't tend to do much of physical activity. It's very important that they are actually physically active during pregnancy and after as well. Other than these two things, probably if there's anything more, I will let Priyanka add. But overall, if you're not putting on too much of weight, you're relatively safe because when you are in the childbearing age, you're young, you're definitely less than 40. The risk of catching a severe COVID infection is very less. As long as you don't put on weight and go to that danger zone of beyond 30 of BMI, you're relatively safe.
So there's a lot of obesity related problems that we are seeing in children as well as these teenagers. So how would you? Is there anything that you would like to throw as comment on that?
Yes, adolescents, especially these days, because of being overweight and obese, they are contracting other infections apart from COVID, other easy infections also easily. So more than that, they are also susceptible to metabolic syndromes, like Dr. Deepak said. So they are having diabetes at an early age. Children are having other issues like PCOS, so polycystic ovarian syndrome, has become super common in girls as young as 14, 15 years of age. So all these have become very common. So and these also go hand in hand. So polycystic ovarian syndrome and diabetes also go hand in hand. And along with that, they also tend to put on weight, and losing weight is difficult because there is a hormonal imbalance. So being very careful about what you eat, about your lifestyle, about your sleep cycle, your stress, being very watchful of all these actually helps.
Yeah, it's actually a vicious cycle, getting into obesity, hormone imbalance like infertility or PCO and stuff. And somewhere this needs to be, there's always this thought that obesity is the reason for PCO, and when PCO comes again, hormones again, that leads to obesity. So somewhere the chain needs to be broken, and that's the most the most important challenge that most healthcare workers, us, we face in patients come with us with both obesity and infertility.
From a lifestyle change point of view, if there are three things that one can start off as on now today, what are those three things as a mantra that you have to say?
I'll answer my part on this, and then maybe others can answer. I think three things which I again mentioned is being physically active. It does not again mean going to the gym. It does not again mean spending a big amount of money to your gym membership and going and working out. No, it's simply physically active, where you could probably take your vehicle if it's a possibility of walking. Do that and try to. And people always say, I walk. I walk during my work hours. I move from here to here. No, if we can dedicate about half an hour to 40 minutes every day for our own self, I think that's more than enough to be physically active. And I think the other two are pretty simple in terms of having a good nutritious food, like what Priyanka has mentioned. And the third important thing is very easy to say, but I know it's very difficult to do it. Try to reduce stress in life, because that can cause multiple of these problems and lead to these issues.
So, Mrs. Priyanka, what are the foods that one should eat and one should avoid when they are, maybe stuck in COVID, not too much of movements, sort of a sedentary lifestyle? So, any thoughts on that?
So being at home, you're not able to access anything from, even the supermarket. So what you could do with whatever things that you have at home, try to stick to a plant-based diet as much as possible. Avoid any animal-based food during infection, because there might be other secondary infections that might come up if you don't cook your meat properly. Second is to make use of the whole grains that are available at home. Millets and small grain varieties are plenty these days, so there are too many options available. So if you could stock up on these, which are non-perishable items, so these can be stored for a very long time outside in a normal container. So if you can, stock up these and make use of these whole grains, which are fortified with vitamins like vitamin A, B, and so on. So all these will be very helpful. Apart from that, drink plenty of water, at least like 2 to 3 liters every single day. So that will be very beneficial for you. So stay hydrated, even if you're indoors, stay hydrated, eat whole foods, avoid animal-based foods as much as possible, and stick to a plant-based diet.
The last question before we request you to place your last final comments would be, how is MGM a go-to comprehensive center of excellence for anything related to stress management, lifestyle management, GI related problems, weight and obesity related problems? How do we tackle this as a team, as a comprehensive center?
I think the best part about MGM Healthcare is we have the specialists under one roof, all the specialists that are required for this. And the approach towards this is not about, I'm a bariatric surgeon, but that does not mean that every single patient that comes to me undergoes a bariatric surgery. The right specialists are involved, and generally we try to create what is called as an obesity board. I mean, I can talk about obesity because that's one of the things that we are talking about today. So we try to create a board where a single patient who is discussed among a group of specialists who probably sit together and take the patient's profile and come together and say, this is possibly the best way of management. And this could include stress management. If the obesity is because of stress, then stress management, we try to involve the clinical psychologist, the psychiatrist here, and then give them counseling. If it is possibly something related to hormone imbalance, we get the endocrinologist involved. If it is more infertility related issues, the gynecologist is involved. If it is just a diet and lifestyle change that is required, Priyanka is involved. And if this doesn't work out and all this is fine, and then this patient will benefit from a surgery in terms of bariatrics, then a person like me is involved, who will probably give them options for surgery for weight loss. At the same time, we also deal with the patient's other GI issues that they have, because when taking a surgery or any role for that matter, or even a change in the diet can lead to some change in the gastrointestinal tract and the way they are, causing some dyspepsia and many other things. So again, we have a complete array of specialists like medical gastroenterologists and surgeons like us who take care of the GI tract. So it's a complete teamwork, and I think we have specialists under one roof to probably address all these issues in one room.
We have to definitely address one topic because we have spoken a lot about this in this forum, about bariatric surgeries. Now, bariatric surgeries are usually something which people know that it exists, but there's a lot of cloud to that topic. So can you shed some myths about the surgery?
Yeah.
Does that alter somebody's, because there's a lot of misconception among people about the surgery, leading to a lot of issues later in the future, and a lot of normal or organicness going for a toss.
Yeah.
So can you
Yeah. So bariatric surgery is as you rightly said, is in our part of the country, in South India. We are a very conservative site. Okay. When you look at compared to the north and south, if you look at it, south is supposed to be a little more conservative compared to the north, and people don't want to go for surgery for just weight loss. And that's something which I found as a big myth. And people are scared about getting the surgery done in this. In fact, I have had patients who have clearly will be under the indication of bariatric surgery. They have not benefited from any other methods of weight loss, but they would still want to live with all the risks that come with obesity rather than going under the knife, which is a simple bariatric laparoscopic procedure, which is a couple of days in the hospital, and there is effective weight loss along with that. People are worried about complications. Now, yes, no surgeries without complications, but today the procedures are completely standardized so well that if a procedure is done, there's so much of steps that we need to complete, and every single step is complete. Without completing step 2, we don't move into step 3. It's so much standardized today. And with so much of standardization, the complication rates are as less than, I can very much strongly say that the complication rates of this particular bariatric surgery is much lesser than many other common procedures that are possibly done in any hospital. It's as much standardized as much. And the long-term effects, in fact, the long-term effects are very minimal in terms of possibly some mild vitamins or mineral deficiencies, for which we just replace them with vitamins by just a single capsule per day. And it's not for every single person. And it is specific for that particular person if there is some deficiency. So there is no big long-term problems in these surgeries. And lastly, I want to say is, if the right surgery is done for the right patient and the correct pre-op and post-op methods are taken care of, I think this surgery is a life-changing surgery and it's extremely successful.
Perfect. Thank you, doctors, for this wonderful and enlightening session. I'm sure a lot of viewers would have, taken home a lot of positive messaging from this, and the success of this will be even if 50% of the viewers from today from this session can start implementing these things in their lifestyle. We have reached somewhere. So one take-home message from each of you, if we can, and then we'll close the session.
Bye.
Stay safe, don't get COVID.
Yes, be as healthy as you can. Incorporate small lifestyle changes that you can in your daily life. That will lead to, not going to the ICU or anything.
Yeah, stay safe. I think we've told enough. I think we're not here to just preach about weight loss and stuff. But again, at the end of the day, try to be fit and healthy. So, it's not only about COVID, it's about any other disease as well. So thank you.
So that's all for today for this session. We thank you, doctors, for having this wonderful session for our viewers, and for everybody who's watching this or who will watch this later. You can leave any comments, any questions if you have, and we'll be happy to answer them from the doctors. And yes, one final sign-off message will be the fact that there's a saying that it's not about the large gains, but it's about the small wins. So let's look at the small wins and shed your weight, shed your COVID risk. That's all. Thank you so much.